Good afternoon, everyone. I hope you're all doing well today, and welcome to our webinar today with WorkNest. What we'll do is we've had a lot of people register for today's session, so we're just going to give a slight pause for a minute or so just to let more people join in, as I'm sure if anything's like my diaries, people are bouncing to and fro meetings. But really looking forward to this session today. I will ask if we could just have everyone on mute for the presentation, if that's possible. And I'll ask my colleagues on just to go through just to make sure everyone is on mute. And then after this pause, we'll just go through some of the housekeeping rules before I pass straight over to Julie. Whilst we are waiting, you can scan the QR code there to learn more about WorkNest, but we'll be talking through that in the introductions as well. Excellent. So just before we get on with the presentation, just want to go through some housekeeping rules. So this session is being recorded, and that's because a lot of colleagues did highlight that they would like to learn from this session but are unable to do so because of conflicts. So this is being recorded so we could share a recording to all attendees as well as a copy of the slides. And we've had a number of questions submitted already for this session. And although we do have a Q&A section at the end of today, well, I'm sure there's going to be more questions that we can answer in the allotted time. So we'll be sharing some feedback from that as well. If you do have any questions that you want to raise anonymously rather than raising a hand or coming off of mute or using the chat function, please do email myself at fricketson@careengland.org.uk, and I'll ask my colleague Sonam to put my email into the chat. I'll be monitoring my emails in between moving the slides and whilst Julie is presenting, so I'll be able to share those anonymously with Julie. So I will just pass over to the next slide now, and that'll be enough from myself, and I will introduce you to Julie from WorkNest. Julie.
Thank you, Fraser. Hello, everyone, and welcome to today's webinar. I hope you find it all very useful by the end of it. My name's Julie Walton, and I work for C4Q, Care for Quality. And today we're going to be looking at the CQC single assessment framework. We're not going to spend an awful lot of time on that, and I'll explain why as we go along.
Sorry, guys, I'm going to make the sound go off.
Sorry, we've just got a few people on microphone with them. Mics unmuted, so if we can make sure they are muted, please. But carry on, Julie.
That's absolutely fine. So we're going to look at the single assessment framework. We're going to look at what good looks like, common pitfalls that we're finding, and some quick wins that you might want to consider. And then we're going to tell you information around how we might be able to support and help you going forward. Next slide, please, Fraser. So who are we? Well, we are an organisation that's very in tune with supporting health and social care providers. So it's really important that we help our clients to stay compliant and feel confident and inspection ready when it's time for the CQC to either assess you, as they do these days from a more remote way, or they actually turn up at the doorway. So we do provide mock inspections, and we as well as remote audits, and they can be tailored to your service. We have comprehensive policies and procedures that we can support you with so that you can make sure that your policies are constantly up to date and changing as things are ever changing. And we can provide ongoing compliance support, and we can create packages of support that suits whatever it is that you need. So there's not just one size fits all. And we have quite an expert team of people that work with us. So we're very lucky that way. Thank you. Fraser, next slide. Right, as I said right at the beginning, we're not going to dwell too much on the assessment framework. We know it's moved from single assessment framework to now the assessment framework, and every one of us, I'm sure, has felt the difficulties one way or another over the last year or so with CQC, including CQC themselves. So basically what has changed? It's probably easier to start with what's not changed. What hasn't changed is the general legislation, the Act. And the regulations, we've had an extra one that came in around accompanying care for people who live in accommodation and hospices, etc. But apart from that addition, generally speaking, the regulations haven't changed, and those 5 key questions that we're all used to by now, they have not changed, that they are still assessing in that fashion with those 5 key questions. What has changed is how they've presented what they're looking for that sits underneath those 5 key questions. So previously we would have key lines of inquiry, fondly known as Chloe's in those days, and they were pretty good actually, most of them, I think, personal opinion, because they were quite straightforward in their language. So things like safeguarding training, you knew where you stood about, you needed to have safeguarding training. And that's not been lost entirely, but they've represented it in a different way. So they've replaced those sub-questions, those key lines of inquiry that used to sit underneath the 5 key questions, safe, effective, etc., with quality statements. And if you just see on this slide, we've listed the quality statements. I'm not going to go through every single one of you, and I'm sure that you have read them or seen them previously. And effectively, they do contain the same sorts of things that were there before, but they're framed in a different way. So one of the things that is massively important, sorry, I think I've got some background noise going on there. So one of the things that actually, even though it sits in safe, is learning culture, you will find that's actually really relevant to all of the key questions. Now, CQC have, as many of you will be aware, have had their own effectiveness assessed, and they've had their comments and critiques about the quality statements, and they are actually reworking some of them and looking at them. It's a really great opportunity now to get involved if you can, because CQC are consulting everybody. There's real opportunities to feedback your thoughts about the new assessment framework and the quality statements. So if you've got the opportunity to take part, please do. It's really important that your voice is heard. And so although we are at the moment working with the quality statements that's there, please be advised that things are likely to change, not necessarily in a great way, more of a tweaking, maybe some simplification. There's a lot of duplication at the moment, and some different ways to interpret some quality statements that's not helpful. So they're working on that. So to just give you an example, it looks as though within the caring key question, workforce wellbeing and enablement, it never really sort of sat particularly well. I agree with that conclusion. It's never really sat very well in caring, although you can see it's a very caring thing. Under the caring, is it caring key question, it sits better in the well-led, because one of the things that leaders need to be is compassionate leaders, inclusive leaders, and you really need to care about your staff's welfare and support your staff. So it really sort of sits better, and it's likely that will be one of those quality statements that might actually move places into it. So what you need to do is just keep an eye on what's happening with the latest news. If you're not already signed up for the e-bulletins and the latest blogs, and there's lots of information that keeps coming out. We're not there yet on answers on everything, or quite a lot of things really, but keeping yourself up to date is really important. And hopefully when they do start to roll out amended, updated quality statements, and it doesn't mean that they're all going to get changed. It means that some of them might change, some might disappear, some might move, as I've just said with the workforce wellbeing. So keep an eye on it. And it looks from when you read the CQC website that they're going to be incrementally changing rather than a wholesale change, which I think would be a welcome thing, because one of the problems we've all had was wholesale change in one go, which is really quite hard to deal with. So I think keeping an eye on what's happening with the CQC website, getting involved if you can, making sure you're signed up to their latest e-bulletins and listening to webinars and blogs when they're around would be an extremely useful thing for you to be doing. What hasn't changed in a way is the rating system. We did sort of lose our way a little bit between the single assessment, new strategy framework through to what they're now, and the scoring system and all that was quite complicated that they came out with. So you'll still see outstanding, good, requires improvement, and inadequate. So those references will still be there. So reporting, when they're doing their reports, you will still see references to that when it's part of the rating process. How they're going to make their judgments, they have decided that they're not necessarily going to be doing all the quality statements in one go, which, as you can imagine, would be quite a fate, really, to do that in one go. So can we have the next slide, please, Fraser? So I'm going to hand over to Fraser. There's a poll now, and your views are really important to us. So if you could take part, that would be great.
Excellent. Sonam, if we could launch the first poll, please. And if we could have a few colleagues in the chat just letting us know that the questions have arrived for everyone. It's just the first poll now. There might be an option to scroll further on, but we just want to see question 1 for now, which is what level of change have you made in the last 12 months? So if we can just answer those ones for now, we'll launch the poll again later in other sessions for subsequent ones. Thank you everyone for confirming. Excellent. Sonam, if we want to maybe perhaps close the poll for now, just so in the interest of time, I think it's been about a minute or so. Oh, I see a couple hands coming up. Shaziz, do you have a question? Might be a legacy hand. Excellent. Have the results been presented to us, Julie?
No, I can't. No, can't see the results at the moment.
Okay. There has been a number of changes happening at Microsoft Teams at the moment, so there might be some errors still ongoing. I know I've had a few issues with my system this morning. Okay, so some of the members can be seeing them. Maybe if, just for the interest, because I know a few say we can, others say we can't, if we could just indicate within the chat as well some of the responses to the questions on the slides, on what level of change has been made. Seeing a few people have said that they've made substantial changes already. Julie.
Right.
Excellent. Shall we go to the next slide?
Yes, please.
A few more there saying minor changes have made substantial changes. Thank you, everyone. Perfect. If you'd like to go ahead with the next slide, Julie.
Yeah. So one of the main things that we get asked a lot about is gathering evidence. And one of the things that you will find, and we'll talk about it a bit more in a couple of minutes, is around gathering feedback. Feedback it's always been important to the regulator, always been interested in what service users' views and others' views are. Staff has always been part and parcel of any assessment inspection process, because obviously they are the experts of what it's like to work in a service. And what you'll find is an increasing importance is being placed on staffing views as well, and that's very clear when it's part of the evidence gathering that the CQC are emphasising now. So it's about looking at what's useful information around people's experiences, prioritising feedback, and also looking at what your staff views are. And then it's really looking at your own processes and procedures, such as your policies. So we'll look a little bit more in detail about these in a second. The CQC is going to gather information from a whole host of places, and that's not really changed since previously, because if you think about the old ways of doing things, that even pre-Chloe's and rating days, they would still talk to the stakeholders. So it could be your commissioners, it could be the local authority, it could be that was a health watch visit took place. People's views, patient service user representatives, as well as the service user views advocates, have always been of great interest to CQC, and the staffing views and consultation is now really starting to come to the fore as also a very crucial part and parcel of you working out how well your services is offering and the value and how safe people are being kept. Now, at one time, the CQC used to assess or gather what they knew already in their kit bag. So what do we know back at the office about your service? That could be things like notifications, for instance, incident reports that might have come their way, complaints that might have come their way. So it's about what do they know already before they even start to decide to come out and visit you, which is how it used to be. And then they would come and turn up at your establishment or work with you if you're domiciliary care to work out how they could access your service users and look to assess your service. So, and the judgments and they were all put together, and that then went towards the rating system. And so gathering evidence is always been there. It's not changed a tremendous deal, and we'll look at evidence in a second. The frequency of rating, now it's really important this to providers, because when the rating system first came out, it sounded a really good system to know what was inadequate, what requires improvement, what was good, outstanding, great if you got outstanding. But the problem was that the frequency system that was in place meant if you were inadequate, you were going to get frequently re-inspected and have that monitoring oversight. If it requires improvement, it could be around 2 years, even less for good and outstanding. And these were sort of drivers towards when the next frequency, the next inspection. But for people who were stuck in the requires improvement slot in the rating bracket improvement, that had major implications on them. It could impact reputation, it could impact licensing if you were a health service, it could impact contracting, it could impact people's attraction to come into your service. So the requires improvement has always been a little bit of one of those that is not a great place always to be in. The system that they've brought out now is that they're putting percentages to these different ratings. So actually, if you are going to be in the requires improvement rating level, you will be able to see whether you are actually in danger of being rated inadequate because you didn't perform very well, or you just missed out on being good. And one of the frustrating things that's been around for since the rating system came out is that quite often people have put things right quite quickly. So it might have been requires improvement when they were inspected, but they put it right quite quickly and then they couldn't get re-inspected and then re-rated. So there's a lot of history that's gone into how just by judging of an inspection, stepping over the threshold, it was too rigid and it's caused a lot of problems. So it's a good thing, it's a positive thing that CQC are moving away from making judgments just by the need to cross over the threshold. And we must never forget that CQC will always be able to come and should be able to come out and inspect a service if there are concerns raised, because ultimately it's people's safety and welfare and their quality of life that matters. And if they've got concerns, then they have the right to come out and inspect. So on top of any frequency or decisions to make an inspection, they will always take on account any concerns and risk. And so that would be an important thing. So you'll always have the ability to do that outside of any frequency. Judgments on quality are going to be made more regularly. They're going to look through quality statements. They're not necessarily going to be look at every single one. There's going to be more information. As I said, keep your eye out on the website for more information about that. But they are looking at just doing certain quality statements. And I suspect going forward, we will hear more around what quality statements are most likely to be looked at routinely and also routinely in specific services, because obviously a GP practice has a very different service to a supported living situation. So I'd love to be able to tell you what they're going to be doing, but at the moment we're still waiting for news around what they're going to be rolling out with their quality statements. But the evidence sources, so if we go to the next slide, please, Raisa. So as most of you should be aware, and if you're not, please, one of the things that you can really do to help yourself is get familiar with the CQC assessment pages on their website. And if you want to look at something specific, you can just Google it. Actually, it's what we do. We Google CQC evidence categories and you can go straight to the page, and it can save time, but it will benefit you to really get to know the CQC website. So on this, you'll see there's 6 categories here. People's experiences, and I've said earlier, massively important to CQC, always has been. Feedback from staff and leaders is nothing changed. There's nothing new about that. Observations of care, always done that. Feedback from partners. Now that, if we relate back to what I said earlier, feedback from partners can be a whole range of partners. It could be, depending of course on what your service is, it could, so if you're domiciliary care, for instance, some of your partners could be your local health services, the GP practices, the multidisciplinary healthcare teams that come into a care home. It could be your commissioned services, if you're commissioned by a local authority. There is a whole range of stakeholders out there, and what I mean by stakeholders is those groups of people that you liaise with, that you work with, that you either contract with, or you provide services with, or you share a network with. And so there's an awful lot of people and categories of groups out there that it would benefit you to get to know yourself, who you are, your main people that you talk to, and never forget your main feedback. Your main is your service users. So one of the things I would suggest that you do is sit back and think, right, who are the people we liaise with mostly? Who are our main stakeholders? And that includes staff groups. So your internal ones would be your staff and your service users and their families or advocates. And your external ones, who are they? Are they the commissioners? Is it a local association? Is it some of the local authority? Is it your local healthcare services? Who is it that you engage with most? And then ask yourself the question, what do I think they think of us? What impression are we giving? What's that outward impression we're giving to people? Because remember, part and parcel of what CQC going to be doing is talking to these partner agencies and asking for feedback on your service and how they engage with you. And so it's really worth to have a think about how you're going to manage those relationships. It's really important. Processes, again, this is not really anything that's new. It includes looking at your documentation, so your care plans, your risk assessments, your audits. It's looking at how you're reporting upwards, depending on your structure within your organisation. How does information get up to the senior leadership team so they can make informed decisions? How is messaging going down? So it includes how's staff training? How are you capturing compliance to staff training? How are you capturing incidents? Which incidents fall into the duty of candor threshold? How are you working that through so that you can keep that helicopter view? But it absolutely, when you're looking at evidence on processes, it is a whole raft of things. There's no one thing, and it will depend on the kind of services that you have. Outcomes to care is an interesting one, and it's very, very common and has been for quite some time in the health service, because obviously they have much more formal processes looking at outcomes to care. So, you have clinical outcomes on prescribing and different conditions and different outcomes that's expected through a healthcare scenario, and how patients feedback how their health is improving. It's not been that common in the social care world. And so it'd be really interesting to see the sort of guidance and how CQC will go forward in looking at outcomes eventually as an evidence category. But what I would suggest to you is that you have a look at your care planning and how each of your care plans for your individual service users and how well they're doing on the person-centered assessed care and the planning that goes on and the risk assessments and how their health is being maintained, how it's improving, the outcomes to things like your own audit system. How is that showing that, yes, we've learned from this and this is how we've changed. We can share that this has impacted our service users in a beneficial way. So there's lots of things that you can start to think about on outcomes, and you can do case studies as well on something that's particularly gone really well. So these are sort of things to start thinking about, but we are still looking for guidance from CQC around how they going to look at social care and outcomes and whether it's going to be part and parcel of going forward, because at the moment it's not 100% clear. Next slide, please. Fraser. Right, so you're going to hear me a lot today talk about feedback, so apologies for that, but I can't emphasize enough how important it is. So obviously different service users have different abilities to be able to feedback. And so it is very much about how can you assess your service user feedback. Some people have communication difficulties, some people have language difficulties, some people have learning difficulties, disabilities. So it's really about you knowing the people that you provide a service to and how best you can communicate with and how you can advocate and empower them to be able to give you their views. And that includes their families, their carers, their advocates and others that's involved in their life experience, really, those important people in their lives. And it can include things like surveys, focus groups, suggestion boxes. Even your complaints process, in a way, is a form of feedback. Compliments are always great, aren't they? So it's been having a system in place where it's very, very clear how you support and enable people from your service to give you feedback on their experience. But remember, no matter what you do and wherever the feedback is, or whether it's even information from an audit, it's no good just gathering it. And we'll look at that in a second. Staff input, as I said earlier, the ante has gone up on the importance of staff's views, and they're a great resource because they know the place, they know your service, and they can come up with some great ideas or concerns and listening to what's not going well and perhaps bring some innovative ideas. So they're an invaluable source of information. So it's a really missed opportunity if you don't listen to your staff. And CQC will listen to your staff, going back to that evidence tables when they listen to leaders and staff, they will be asking your staff questions about the care they're giving, the support they're getting, the training, supervision, appraisals, all the things that what they went through for recruitment that can sometimes get asked. So they will get asked those sorts of questions. So where would you put the evidence? How would you find that evidence and demonstrate that? Well, it should be, you should be able to see it in staff minutes. So staff team minutes are an invaluable source, and you will frequently get asked to show those that you have been able to disseminate important information. So outcome to a complaint, outcome to an incident, for instance, should be sitting in your staff team minutes. You can do questionnaires to your staff. You can do surveys to your staff, like SurveyMonkey, you can do that. And obviously things like outcomes from incident reporting and the analysis of that. And it's also really important for you to get out there into your locations and observe staff practice, because it's enormous what you can pick up just by observing staff, you know, whether morale is a bit low, people are pushed for time and what's working well, and get to have those face-to-face conversations. So don't ever forget that being out there and being visible to your staff is hugely important as well. Documentation. Yes, policies and procedures. I would say to you that one of the important things that you should look out for is that your policies and procedures are up to date. And when I say up to date, I don't mean that it's got the latest date on. I think you should be really scrutinize your policies to make sure that they change with guidance changes, that that they are in date. It's very clear. It does reflect what you're doing, because one of the things that CQC will be doing when they come and observe practice is if they'll watch practice, and if something doesn't quite seem to be following what national guidance, evidence-based practice, what they would expect to normally see, they are likely to ask to see your policy. So there's two things about that. One is they'll be looking to see if it's easy for that staff member to be able to access the policy. How difficult is it to access that policy? Can they go on a computer and get it straight away? Is it sitting on a wall displayed? Is it in a folder? Now, the pitfalls of printing things, as you all know, is that it can easily get out of date. The version control can get out of date. So there's a whole range of things that you can notice just by looking at policies, and they'll want to know about staff training and policies. So policies basically are what you're telling your staff what you expect them to do. So if they're behaving differently, not bare below the elbow, for instance, if your IPC, if your infection control policy says they should be, then they're not working according to your policy. So these things are quite easy for CQC to compare and contrast. So policies are really important. They'll always look at patient records, service user records, care plans, risk assessments. And again, they'll be looking at what audits you're doing, what risk assessments generally you're doing, and they'll be looking at meeting minutes to see how helpful, up to date. One of the things that people fall down on, particularly on minutes, is if there's actions that's come out of that meeting. And we see this all the time in our work on mock inspections and our remote audits. It's very frequently, you'll see some minutes, and you won't necessarily have them well written. They may not have people's full names in, roles in, but the actions quite often might just say somebody's got to chat to somebody else, and you don't know what happened at the next minute. So you didn't know if it turned into an action. Was it completed? Why wasn't it completed? So there's sort of very quality issues are looked at as well as the fact that you've got them. So it's looking at your paperwork and think, is this a quality piece of work really? Do we have a standard on how we do meeting minutes? Is there a standard on how we address these things? So have a think about that when you're looking at your documentation. Next slide, please, Fraser. So here we go back to feedback. So why is it really important? It's because it's core. And if you look at the assessment framework, and it hasn't really changed, as I said, over a period of time, it's actually got more emphasis. And when you look on the assessment framework quality statements, and then you narrow it down and look at social care, accommodation, home care, domiciliary care, supported living, you will see that CQC within their evidence categories have listed the evidence categories for that particular quality statement. So you can in advance look up the quality statement and have a look what evidence they're going to be attaching to assessing that quality statement, and you will find that the service user feedback and feedback information that CQC have received directly and give your feedback through to CQC is in every single quality statement. It is a core element of every single one, whereas other things might vary a little bit on the different quality statement. You will find that service user views are sitting there in every quality statement. That just shows you how important it is that you really get a good handle on that. And it's really invaluable for you to really understand the lived experience. They obviously it helps drive improvement, and it is very much seen as part and parcel of your quality improvement and continuous improvement and learning processes. So really, when nothing else you do today, go back and just have a think about how you're generating and enabling people to give feedback. Next slide, please, Fraser. Surveys. Again, it is really about ascertaining and consulting views. So direct evidence, people's experience. So we've all seen over the years, haven't we, different ways of speaking with service users. But it is a great way is to ascertain whether things are going as you want it to do or not. As we said before, it's a very core element of CQC's approach. It helps you decide what's working well, what's not. But please remember, no matter what it is that you're doing, if you're ascertaining feedback, always decide, is there an action here for me to do? Because it's pointless. It's just a tick box exercise if you just gather views and then you don't do anything with it. And CQC will be very interested in the so what. What are you doing with it? What next? It obviously empowers people to speak out, which then is seen as a very transparent and shows you have accountability, which is really good from a reputational point of view. Supporting staff engagement, that helps staff feel valued, and there's an awful lot of good ideas out there amongst your staff group, so they're really well worth listening to. It strengthens partnerships, and it does, as I said before, it builds that reputation. So surveys, looking at what sort of surveys, whether it's a survey, a questionnaire for either service users, depending on their communication needs, and what's the best way for you to consult and ascertain your staff views. Next slide, please, Fraser. So we have another poll
Excellent.
here.
We have another poll, and hopefully we kind of fixed things on our ends now. So Simon, I'm just going to ask you if you can present the second poll. Excellent. There should be, here we go. The answer will be in the chat. Julie, if you can see that. And we will probably not have this session, this poll just as long as the last one, just as it is just gone 35 past the hour. So we will close shortly. Just let a few more responses trickle through. Excellent. I think we can look to close the survey now. Thank you, Sonam, and you will see the results of the chat, Julie.
Okay.
Are you able to see the results, Julie?
No, I can't. Oh, yes, I can. Lack of resources, 10%. Lack of time, 19%. Cost implications, 4%. Not enough clarity from the regulator, 45%. Yeah, that's interesting, actually, isn't it? Yeah.
Yeah, thank you, everyone. We'll move swiftly on, just given time.
And right, so what does good look like? Now, you could do weeks on this subject. It's not something that you can simply just bring down to an hour's webinar, but we sat and looked at it and thought, having looked across a range of reports and from our experience with doing our mock inspections, etc., and also our own background knowledge of regulation. And what is really clear that is worth considering is leadership. Because one of the things that really comes out is that well-led question, a really important key question. And it's about making sure you've got competent leaders, skilled and experienced. And remember, it is that compassionate and inclusivity within the leadership team, and that people are feeling very open to raise concerns, and that it's a learning and value-based organisation. A learning environment is massively important because, of course, that supports a really healthy culture within the organisation. Again, listening is a massive thing that's important. People's voices are heard, and consultation is part and parcel of the everyday business of what you're doing as part of your improvement, and staff are engaged and feel very able to make suggestions for innovation. Equality and inclusivity, it is one of those where it's actually two things. It is about making sure that that service users have equity of access and experience, that also your staff have those real equal opportunities in there. But it's also about safeguarding and protecting people from abuse and discrimination. So it's a two-way thing, really. So it's equality and inclusivity, but it's also about what systems and processes do you have in place to make sure people are protected and not discriminated against. So it's a very much push forward and positive, but what are you doing about protecting people on the less positive side? Systems and processes, again, from a leadership point of view, you'll have systems and processes that's giving the right information up to your leaders so they can make the right decisions, and your governance and reporting processes help support that. And it's how you sit back and look at what you're doing, auditing care plans, auditing risk assessments, auditing staff training compliance, and coming up with any actions from things that's not quite right. Don't just sit on the results or do something once. Make sure that you've got some really clear objectives from any of your action plans that come forward. One of the things that happens a lot is people throw a lot of money or a lot of effort into putting an action in place, and it lasts a few minutes, a little while, and then things go back to normal because it's gone off people's priority list because they're really very busy. So it's about revisiting things and making sure that it's been sustained in future, and sustainability is really important. And again, I've spoken at length about policies being up to date, but the whole thing about your service is that it should really be about person-centered. So a really good service is putting the person central to all the decisions in the care plan about themselves. They've got ability to raise concerns, they've got ability to be consulted, they've got ability to feedback, they're appropriately assessed, and that your documentation supports and demonstrates all of that quite fully, and that you work really well with other teams and external bodies, that partnership working, those other stakeholders, and that's part and parcel. So a person who might move from social care to the hospital and back to social care again, that goes as streamlined as humanly possible because you've really thought about the person and the risks to them and their needs throughout that journey and back. That's really all part and parcel of being person-centered, and these are the sorts of ingredients that you're looking in a good service. Next slide, please, Fraser.
Perfect, Julie. Just want to, just jump in there. We've got 19 minutes left, so I'm just going to ask colleagues on the call if they could put their questions within the chat, just because we do have a few more slides to go through. What we'll do is we'll collect all of these and provide a written response to them. But Julie, I'll pass back over to yourself.
Okay, thank you. Real examples, safe, learning culture, said that early. Really important that you have a learning culture in place, and that part and parcel of what you're doing is demonstrates that very clearly. So some of the things that we found looking across some reports was staff gave good examples of accidents and incidents, and they'd used it for learning. So if you ask staff, can you give me an example of the last time there was an accident, they can say the same with a complaint. Tell me the last complaint. What did you learn? What changed? These are really good things to have in your back pocket. Resident-related events communicated at handover. These are really good things so that people know shift by shift that something has changed and they need to keep an eye out for that person. That meant that risks are identified and managed really quickly, and that overall reduced the risks to that person, and sometimes the staff group itself, depending on the risk. Next slide, please, Fraser. Effective, good practice examples for this. Looking at people with healthy choices. You know, we're just looking particularly at nutrition here. So one of the things is, are you enabling people to really make healthy choices about their food, or you just, you know, have set menus or set ways of doing things? Are people actively having conversations about what's a healthier way to go forward with their diets? Are menus diverse, nutritionally balanced? Do they reflect people's individual needs and cultural backgrounds, dietary requirements? Because these things will be picked up in care plans and risk assessments, and in care homes particularly, it's one of those things that get followed through into kitchen areas and observation of meal times, etc. So it all links together as a theme, but good practice is that you are enabling people to really make choices and be very involved in their own nutrition decisions, and that they're helped to have all of the appropriate meals that they need that meets their nutritional dietary requirements. Next slide, please, Fraser. Caring. Some good examples on caring. Again, we've got some ones that's around nutrition and how meals have been prepared in a pureed fashion that's made it attractive, because when you're on a very limited diet, sometimes foods really are not that attractive and appealing, and you're trying to help people to improve their appetite. So it's about those extra things that's been done to make something more palatable to people who are on those restricted diets. It's also about dignity issues in a dining area, so that people are encouraged and enjoy the taking part in meals, even if they have particular difficulties like swallowing difficulties, that the whole ambience and the setup is around helping people to enjoy that meal process as much as they can within their own restrictions. Next slide, please, Fraser. Responsive. Again, we go back to listening, don't we, and involving people. And we found that some really good examples have been where people have been regularly asked about what they think of the service. Questionnaires have been given out, not just to people, but their relatives and others who are involved in their lives. And they were doing a minimum of 6 months and sometimes more often. So it's not just a once a year scenario, so that you're continuously keeping an eye on people's views and experiences. Telephone surveys was another good example of different ways of eliciting views, particularly from families. And we found that some places were doing those more frequently. Next slide, please, Fraser. Well led. Again, we've already talked some of this previously about the importance of extending those partnerships beyond clinical care and engaging with the specialists and the community organisations. So it's spreading yourself further out beyond your own organisation, and what sort of networking, what are the other people that you can get involved in, those groups that you can get involved in that can enhance the person's experience that's living either in an accommodation setting or needs support to get out into the community. Next slide, please, Fraser. Quick poll.
Solomon, if we can launch the third poll, thank you very much. And we'll give members a few seconds just to quickly answer which area caused you the most concern with regards to complying with the CQC framework. Are members seeing the poll? Let's give it a few more seconds. Excellent. We've had about 50% of the group answering, so if we can close the poll. Thank you, Solomon.
Yes, I can see a question about will the slides be mailed out? Yes, they will be.
Yes, they will be.
And we can actually see them this time. So learning culture, yeah, that's a really important one, and it's so multifaceted. It's not one size fits all. There's lots of things that's built into a learning culture. Risk management, safe staffing is much lower than I anticipated, actually. Risk management, yes, risk management is really important issue. So yeah, some really good answers there. But learning culture, yeah, it's a big one. Thank you very much. Next slide, please. Okay. So 5 common pitfalls from the 20 inspection reports that we looked at, recent ones. The 5 areas that mainly shone out were risk management, care planning, safe staffing, medicines, and learning culture, as yourselves have picked up there. Risk management, again, care planning. Next slide, please. So what did we see about risk management? Well, some of them were out of date, incomplete, poorly written, not triangulated, not monitored. So they were done once and then not revisited, or not revisited when things changed. Some risks were missing. Documentation quality, that's something that you often see quite a lot, and not person-centered. So what you really need to be thinking about is, what's your risk management policy? What is it your staff need to know, what your approach is on risk management and about risk assessments? What's their responsibility? What does it look like? Introduce an audit process so that you yourselves are taking control of how often you have a look at those care plans and risk assessments. Ensure that you share any ideas of improvement with your staff. You carry your staff along with it. Make sure staff training is up to date. And ensure that if anything changes, that you're making those changes very clear to staff so that they're keeping on board with it all. And keep a central record of risk review dates so that you don't lose sight of when the next one's due. Next one, please, Fraser. Care planning. Again, very similar to risk assessments. We saw contradictory information, inadequate care plans, some of them illegible. There was lacks of systems of checking. Non-compliance with MCA is something that we see ourselves in mock inspections quite often. Not person-centered, again, another theme as you think about it that's coming through. So what do you need to do? Make sure that you have a clear person-centered care planning policy and your staff know about it. Make sure you have proper review processes in place. Make sure that you introduce an audit and assessment of your care planning, and that it's a routine, and that anything that actually crops up that you are sharing with your staff, because staff need to be learning and changing as things need to change. Discuss those audit findings. Clock it into your staff team meeting minutes. Nice way to demonstrate to CQC that you're having those discussions. And re-audit after you think improvement, just to make sure it's sustained. It hasn't been a one-off, it's sustained. Next one, please, Fraser. Safe staffing. I was surprised that I didn't say safe staffing, because it's such a key area. And it does come up a lot in CQC reports, because obviously they're going to look at safe staffing. It's a normal thing for them to do. And there was issues around recruitment practices, staff files, training, non-compliance, out-of-date training, lack of supervision. Some managers coming through have not really had the right backup support, necessarily have the right training for themselves. Poor deployment of staff, even initial checks being found that hadn't been done properly at the recruitment. Then, of course, alarm bells ringing about your recruitment practices right at the beginning there. So what's your recruitment policy? So it's about being very clear about your recruitment, training, supervision policies, that everybody's aware of them, that you are keeping a check that they're going on. Make sure that you've got an adaptable dependency tool, and that you use it and it changes with the dependency of your client group. Reviewing your staffing levels, skill mix, deployment, making sure you're keeping records of that. Observe those staff interactions and workload, because you'll be able to see from the floor how things are working well or not. And again, it's having that audit process in place. Next slide, please, Fraser. Medicines management, another one that frequently comes up. Again, documentation, quality of documentation, incomplete, inaccurate Mars charts, not necessarily having PRN protocols or risk assessments or care plans for particular medicines, missing high-risk medicines, for instance, outdated training, incorrect storage, and infrequent auditing and checking process. It's really important that you do keep a really tight rein on your medication processes. So it's, again, back to the policy, which we mentioned earlier. You need to have a clear and up-to-date medicines management policy that your staff know and understand, that's dealing with medicines, that there's a regular audit system in place, and that staff have had the appropriate training, and that you regularly revisit training. It's not, oh, it was 5 years ago. Make sure that it's a regular thing, so that staff are always keeping up to date and are competent in dealing with medicine management. Where there's errors, let's see where those lessons are learned and how you're recording those, and how staff are understanding what needs to change. And again, you need to make sure that any change in practice improvement is disseminated to your staff. So it's again capturing it in those staff meeting minutes, which is really nice evidence that I've already said for CQC when they come to demonstrate that you are learning and sharing. Next slide, please, Fraser.
Just as a reminder, Julie, just we have 6 more minutes left. Yes, so just to the group as well, please do keep putting your questions in the chat and we'll respond to them in the material wrap up.
Okay. Learning culture. Again, I think we've said a lot about the learning culture, really. It's not sharing lessons learned, it's failed risk management, it's incidents, it's about your processes not capturing and recording things appropriately, but it's also about learning from what you're finding out, and that includes complaints, that includes feedback, that includes consultation, it includes, you know, external partners, safeguarding, anything that's coming your way that needs to help you learn lessons and change, and having that really open environment, people feel absolutely safe to raise concerns and know that it's something that is seen as a good thing. So it's about recording those lessons learned, consulting with staff on how we can improve things, reviewing policies to making sure that they're really up to date, staff understand them, good communication on investigations and outcomes, and those improvement plans, making sure they've got actions that actually mean something that you can measure and that they are then followed up so that they have been sustained in future. And if they haven't, it's all right to change them, but just then again, go back and check that they are doing what you want them to do. Okay, thank you, Fraser. So the biggest one of all was the well-led. And we've talked about a lot of well-led throughout the whole of this presentation, but it is the poorest performer in those reports. And it included a whole raft of things, all the things that we've talked about up to date: delayed statutory notifications, inaccurate fragmented documentation, poor risk management, outdated policies, training issues, superficial ineffective audits, insufficient provider oversight. Sometimes you don't get the support for the manager that really should be there. All of the things that we actually covered in the other areas previously. Next slide, please, Fraser. So what can you do? Well, you could get a mock inspection, which gives you an outside neutral objective view of your service. You need to check your evidence. You need to prepare your staff. And how do you prepare your staff? It's, you know, work with your staff, give them information on what to expect so it's not a surprise, and help support them with you making sure that your policies are up to date, that staff have had the appropriate training up to date, that they can access things, they know where things are. Involve your service users, because remember, they are a real key player in part and parcel of the information that CQC will be collecting. Audit your environment, check that everything is as it should be, because the last thing you want is to have broken things or evacuation routes blocked or things like that. So audit your environment, make sure health and safety, fire safety is appropriate. Next slide, please. So, as we said right at the beginning, there's a few things we can help you with if you would like more information on, and that's our mock inspections and policy creation, and of course compliance support. There'll be some more information comes with you with the slides, and also we will be working on those answers that we didn't get to at the end of this webinar. So over to you, Fraser.
Excellent. Just got one more quick poll, Simon, if we can pull this in. This is just to help guide some of the materials as well. So if we can just have a few responses from the group, that'd be fantastic. We'll leave this open for a couple more seconds before we look to close, just give them the time. Also put this question with the materials that we send out, including the slides and a FAQ sheet, as well as a copy of the recording of today's session. So all the materials will be shared, but you'll also be able to get more tailored advice from this. But Simon, if we can look to close the survey for now, and we'll move to the next slide. So the next slide is the question and answers, Julie. However, we are just 1 minute to time now.
Yeah,
I appreciate that other people may need to leave to other meetings. So what I'll do is I'll stop sharing my screen. I do just want to thank everyone for attending today, and thank yourself, Julie, because that was an incredibly detailed and informative presentation that you gave us, and I've certainly come away with a lot of knowledge and information, and we've had a lot of questions shared within the chat. Unfortunately, we won't be able to respond to all of them now. However, what we will do is we've noted all these questions down, and we will send it with the minutes with a kind of brief answer to all of them, and we'll also share Julie's contacts as well as everyone else, just so that we can get all the answers delivered. And if there are any more questions, please do email myself. I'll just type my email into the chat now. I'm spelling my name wrong. There we go. Always embarrassing. I'll put my email into the chat. If you have any more questions, please do reach out and send them over there, and we will include them in the FAQ sheet that will be shared shortly. Thank you all for your time today, and thank you again, Julia. It's been amazing.
No, thank you everybody for joining us today.
Thank you.